So to begin with, how do you think unplanned pregnancy can affect women?
Yeah, I think overall unplanned pregnancies unfortunately can lead to health consequences, including physical and mental health. And it can also lower the educational and employment potential that women can achieve. But the good news is over the last several decades, I have seen some significant gains in women making strides in education and in the workforce. And to me, that proves that women want to take control of their future and want to be able to plan it out. So more than ever, it's important that women know their options about birth control and know how to have that conversation with their physician.
How has the pandemic impacted the way women think about family planning?
Yeah, that's a great question. Over the last 2 years, I have seen my patients' daily activities, routine, work, and of course, family planning goals change. And actually, according to a recent survey, greater than 40% of reproductive age women have changed their plans about when they want to have children or how many children they'd like to have because of the pandemic. So given that statistic, it's important that women realize that knowing your birth control options, which ones are available to you, and also which questions you can ask your physician and how to have that conversation is just so important in this moment.
How do you approach contraceptive counseling to help each woman choose a method that could work best for her?
Yeah, that's a great question. As a mom of three myself, I've had that personal conversation with my own physician, and of course I have these conversations daily with my own patients. I think to start with, it's important to make sure you feel comfortable with who you're speaking with, whether it be your physician or another female healthcare provider. I think you should go in with any questions you might have about different birth control methods, and also make sure you ask your questions regarding misconceptions, since there is a lot of misinformation out there on social media. And that's why I am working with this great women's health company called Organon, because I want to be able to bring that messaging to you and your audience.
What type of birth control options are available to women? I mean, there are quite a number, obviously.
Right. So there are what I would call more the short-acting options, which are the more commonly known ones, such as the oral contraceptive pill. There's the patch, the ring, and the injection. And then there's also a category called long-acting reversible contraceptive methods, which are the intrauterine device, or IUD, and the implant. And finally, there's a more permanent option called tubal ligation or sterilization.
What are some final takeaways that you'd like the audience to know about?
Number one, please educate yourself on all the options that are available. Number two, make sure you are open and honest about what you're looking for in a birth control method, and take your questions to that consultation so that way that it can help you make the best decision for yourself. And then finally, I would like to share our website where we have more information about birth control options and how to have that conversation with your physician. It's www.whatsnextforher.com. Thank you.
Thank you so much for all this information. I appreciate it.
I appreciate you. Thank you so much.